individuals above 50, especially those with chronic conditions, some vaccines offer crucial protection. Winter brings additional respiratory risks, making it vital for older adults to stay updated on vaccinations. So, recommended vaccines at 50 are annual influenza vaccine, pneumococcal vaccine, shingles vaccine, MMR, tetanus, diphtheria and pertussis, that is Tdap, hepatitis B vaccine and COVID vaccine. So, we need to counsel the patient after childhood. I think they really need to know that vaccination is required at all ages. So, importance of vaccination needs to be told to them. Vaccination greatly reduces disease, disability, death and inequality worldwide. So, what is the advantages of giving vaccines? It controls the control of mortality, morbidity and complications. Like vaccines annually prevent almost 6 million deaths worldwide. Eradication and elimination. India has achieved the elimination of maternal and neonatal tetanus and polio by improving access to immunization. Prevention of infection. Complete prevention of persistent viral infection has been demonstrated for human papilloma virus, as we all know. Protection against related diseases. Measles vaccination protects against multiple complications such as dysentery, bacterial pneumonia and malnutrition. In India, the introduction of childhood rotavirus vaccination is projected in the same, it saves almost 150 crores in the treatment costs per year. So, recommended immunization schedule for women over 45 years. So, vaccine, influenza, 1 dose of quadrivalent vaccine annually, starting from 45 till more than 65 years age. Tdap, 1 dose Tdap and then Td every 10 years. Varicella, 2 doses 4 to 6 weeks apart. This is optional, because if the patient has had varicella, they don't need to be given the vaccine. Hepatitis B, 3 doses. This is recommended for high risk patients, those who are prone for hepatitis infections by their profession or by otherwise of their comorbidities. 3 doses, 0, 1 and 6 months are recommended. MMR, 1 dose. Respiratory syncytial virus, 2 doses are recommended. Pneumococcal, PCV 13, PPSV 23 after 1 year. So, historical development of influenza, we all know that it has undergone a development and now we all use subunit vaccine. The advantage of it is that it is better tolerability and lower reactogenicity compared to the other vaccine types. So, limited influenza activity is seen throughout the year in our country, with a clear peaking during the rainy season. The rainy season in the country lasts from June to August in all regions except Tamil Nadu, where it occurs from October to December. So, rationale for quadrivalent inactivated influenza vaccine is that quadrivalent recombinant influenza vaccine protects against 4 different flu viruses, usually 2 influenza A viruses and 2 influenza B viruses depending on the season. It reduces the severe outcomes of influenza as well as the burden on the healthcare system. So, these are the market preparations. So, differences in strains compositions, we all know the 2N and 2B, these are the all names which we don't need to remember. So, now coming to Tdap. Tdap, Seema has already spoken in detail. So, it is contains tetanus toxide, reduced diphtheria toxide and acellular pertussis. Tdap vaccine does not have a live component because it is manufactured using inactivated non-infectious bacterial products that generate a robust immune response. This vaccine has been recommended since 2006 for adolescents and adults. A single 0.5 ml dose of the vaccine is recommended. It is given as deep intramuscular injection, preferably in the deltoid region. Concomitant administration of indicated inactivated vaccines, that is Tdap and influenza, is also acceptable and safe and may optimize effectiveness of immunization effort. Concomitant administration with NTD increases the compliance, because if the patient has to receive NTD also, so it can be given in the same sitting. Cocooning approach, as already Dr. Jyoti Bhaskar has mentioned and Seema has also mentioned about it. Giving single dose of Tdap to all caregivers of the infant less than 12 months who have not received Tdap in the past. It is to be given at least 2 weeks before delivery of the baby. Hepatitis B vaccination, the dosing schedule is 0, 1 to 2 months and 4 to 6 months. No booster is required. The minimum intervals between doses, at least 4 weeks between the doses 1 and 2 and at least 8 weeks between doses 2 and 3. There should be at least 16 weeks difference between the dose 1 and 3. If the patient falls behind on the hepatitis B vaccination schedule, even if a year or more has elapsed, continue vaccinating from where our patient has left off. Series need not to be restarted. Age 20 years and older, 1 ml per dose is required. So, indications for giving hepatitis B vaccination, healthy individuals more than 60 years without known high risk factors for hepatitis B virus infection may receive full series of hepatitis B vaccination. It is not only that high risk people require, others can also take it. People at risk for infection by sexual exposure, sex partners of people who are HBsAg positive, sexually active people who are not in long-term relationship, men who have sex with men, people at risk for infection, household contacts of people who are HBsAg positive, healthcare and public safety workers, people with end-stage renal disease, international travelers to regions with intermediate or high levels of endemic HBV infection, people with chronic liver diseases, HIV and diabetes. Shingles vaccine. This vaccine is indicated to reduce the risk of developing herpes zoster and post-herpetic neuralgia in patients with increased risk for the disease. Immunocompetent individuals who are more than equal to 50 years or immunocompromised patients who are more than 19 years of age and are increased risk of herpes zoster. Vaccination is not indicated for the treatment of these conditions. Once they have had it, the vaccine has got no role. It is only for the prevention. In non-live recombinant glycoprotein E vaccine, RZV is preferred over ZVL zoster vaccine live because its protection varies significantly after 8 years. RZV requires 2 doses administered intramuscularly for protection. The second dose should be administered 2 to 6 months after the first dose. Pneumococcal vaccine types, it is the 2 types are there. One is the polysaccharide vaccine, that is PPSV, and the second one is conjugate vaccine, that is PCV. Composition, the PPSV is composed of polysaccharide capsule of 23 serotypes. The other one is linked to immunogenic protein containing 10/13 serotypes. Types of immune response, T cell independent response is there with PPSV and T cell dependent response is required for PCV. So, immunogenicity, poor or negligible immune response in children under 2 years of age, but antibody response with PCV is enhanced due to conjugation and is effective in children under 2 years also. Booster response, there is no significant booster response seen with PPSV repeated doses, but the antibody response with multiple doses of PCV is much more. Effect on nasopharyngeal carriage does not reduce nasopharyngeal carriage rates, whereas PCV reduces carriage rate, thereby decreasing incidence of the disease. Pneumococcal vaccine is indicated in more than 65 years of age, 19 to 64 years with the risk factors. Chronic diseases like anatomic asplenia, sickle cell disease, leukemia, lymphoma, Hodgkin's disease, multiple myeloma, generalized malignancy. Immunocompromised persons including HIV, chronic renal disease, chronic liver disease, chronic heart disease or chronic lung disease. Schedule age 65 years and older who have vaccines available are PCV 13, 15, 20, 21 and PPSV 23. Ma'am, India में 13 है सिर्फ. We have only 13. अच्छा अभी नया वाला जो आया उसमें है. Okay. Okay. Not previously received a dose of PCV 13, 15, 20 or unknown vaccination history, 1 dose PCV 15, 20 in other countries. In India, we give PCV 13 followed 6 months to 1 year later by PPSV 23. In immunocompromised cochlear implant or CSF leak patients, PPSV 23 is given after 8 weeks. Previously received both PCV 13 and PPSV 23, and PPSV 23 was received at age 65 years or older. Based on shared clinical decision making, 1 dose of PPSV 23 at least 5 years after the last dose. So with PPSV we need to give a booster dose. A single dose of 0.5 ml is given intramuscularly. So MMR in non-immune individuals, 2 doses of MMR vaccine should be administered at least 28 days apart. The dose of MMR is 0.5 ml to be administered subcutaneously at outer triceps. That's it. Thank you.